How to correctly diagnose dyspepsia versus acid reflux. Are you confused about the difference between dyspepsia and acid reflux? You are not alone. Many people experience symptoms that overlap between these two conditions. Understanding how to correctly diagnose them can help you find the right treatment. First, let's define dyspepsia. Dyspepsia is a term that describes a group of symptoms related to the upper abdomen. Common symptoms include a gnawing or aching pain, bloating after meals, and early fullness. Some people may also feel a burning sensation. Interestingly, dyspepsia symptoms can often improve after eating. On the other hand, acid reflux, also known as gastroesophageal reflux disease, primarily involves heartburn and acid regurgitation. Heartburn is that burning feeling behind the breastbone, while acid regurgitation is when stomach acid flows back into the esophagus. And like dyspepsia, acid reflux symptoms usually do not improve with meals. Now, let's talk about the challenges in diagnosing these conditions. Many patients experience symptoms that can be confusing. For example, about 40% of dyspepsia cases are functional, meaning no specific cause is found. Acid reflux can also lead to extraesophageal symptoms like asthma or chest pain, which are not typical for dyspepsia. When it comes to diagnosing these conditions, the clinical history is the first step. A healthcare provider will ask about the nature, timing, and triggers of your symptoms. If you frequently experience heartburn and regurgitation, it suggests acid reflux. If your symptoms include upper abdominal pain that improves with meals, it points toward dyspepsia. Testing for Helicobacter pylori infection is often recommended for dyspepsia patients, but it is not routinely done for acid reflux. Upper gastrointestinal endoscopy is another important tool. This procedure allows doctors to look for organic causes like peptic ulcers or esophagitis, which could explain your symptoms. If endoscopy shows reflux esophagitis or related complications, it confirms a diagnosis of acid reflux. If no abnormalities are found, dyspepsia is often classified as functional dyspepsia. In some cases, additional tests like pH monitoring or esophageal manometry may be necessary if the diagnosis remains unclear. For those with typical acid reflux symptoms, doctors may start treatment with proton pump inhibitors without immediate endoscopy. If dyspepsia symptoms dominate, testing for Helicobacter pylori and possibly endoscopy may be indicated, especially if there are alarm symptoms like weight loss or bleeding. In cases where symptoms overlap or do not respond to initial treatment, further evaluation is essential. This careful approach helps ensure that you receive the most appropriate diagnosis and treatment for your condition. Understanding the differences between dyspepsia and acid reflux is key to managing your digestive health effectively.